So as I mentioned last week, all our indicators are increasing. So Montreal is right now passing to the yellow level, pre-alert level. As I was, this pre-alert level, what it means for all Montrealers, we're not closing down some sector of activities, but what we're asking the population is to increase the application of the public health measures in their everyday life, and especially when they are in a social context or in gatherings, in private gatherings, small and large context. So if you have a dinner, a party with friends, if you're going at a wedding or a community event, it is really important to apply the 2-meter distanciation, wash your hands, and of course, if it's inside and it's an organized event like a wedding or a wedding or another organized event, you have to wear the face cover. We ask people to limit those gatherings if it's not necessary, because we know, and right now, most of the community transmission comes from those gatherings, those private gatherings. And what we're seeing is now is for each contacts, we have a larger number of, for each case, we have a larger number of contacts that we have to isolate because the distanciation has not been applied. So for when we were in March, we had for each contact, each case we had 10 contacts, and now for some cases we have more than 80 or 100 of contacts that we have to isolate. So I think the consequences are quite important for those people. As I said, all our indicators are increasing, and it preoccupies the healthcare sectors and me personally. We also see that the group age 18 to 30 years old is still the group where we have most of our a large number of cases and a high positivity rate. So I encourage them to get tested. If you're in this group age and you've been in a specific context where the distanciation has not been applied, or if you have been in contact with someone that has symptoms or is COVID positive, we ask you to get a screening test. For the school, we have 7 outbreaks, but small outbreaks, only one that is more important, but everything is under control. We have 24 outbreaks in workplace settings and 3 small outbreaks well controlled in elder residency. So as I said, we encourage the population to get tested if they have symptoms, if they have been in contact, or of course if they have been in some private events where we know that the public health measure weren't applied. We ask cases and contacts to collaborate with public health. When we call you, it is important to respond. It is important to work with us to stop the chain of transmission. And of course, my last message is that I think we all Montrealers need to work together to make sure that we are not at the start of a big wave, but a small wave like we had in last July. Thank you.
Minister Dubé today mentioned that there are some regions that are yellow that are close to actually becoming orange. Where are we in that situation? How close are we to possibly going to code orange?
But at this time, we are still in the, we were with the indicators of the last week, we were at the edge of between green and yellow. But what we see with the indicators of yesterday and we'll see today what we have, we see that the number of cases is still quite increasing rapidly. So I cannot say at this time the color for next week, but we have to be prepared.